Hello guys, I am Dr. Mohammedul Kabir. I am a physician. Today I will discuss a important topics, medically important, that is gynecomastia. I will not discuss the pathology or the pathophysiology. Rather, I will discuss how to deal a patient with gynecomastia. That is the clinical evaluation and management of a patient with gynecomastia who practicing as a general practitioner or a medicine specialist or an endocrinologist frequently feel that this is a very difficult situation when a patient present with gynecomastia because it has so many reasons. Today I will say you how to evaluate a patient from starting from the history and then examination and evaluate biochemically and if needed by PU scan and also manage the patient. First, a patient, suppose Mr. Andrew, a 43 years man, presented with gynecomastia for last 3 months. We will start first introducing the patient. I am Dr. Kabir, one of the doctor working in this hospital. Are you Mr. Andrew? 43 years? Yes, sir. I found a letter from your GP that you have a breast enlargement which involving the both breast for last 3 months. We'll discuss about this topics. Is that okay with you? Then yes, it's okay with you. Then first of all, we'll follow a specific protocol, that is analysis of the symptom, then systemic review, then past medical history, surgical history, drug history, then family history, and also personal and social history. After history, we will evaluate the patient through examination. In history part, first of all, we will try to evaluate for how long the gynecomastia is present in this case. Is it started suddenly or after any events like any trauma or any surgery or anything happened at the beginning of this problem? Then how it's progressing? Is it progressing rapidly or is it progressing gradually? And duration, is it more than 12 months or less than 12 months? This is also important for medical purpose, because if it is less than 12 months, then tamoxifen like selective estrogen receptor blocker will be effective. If it's more than 12 months, then this sort of medicine will not be effective because there will be fibrotic change within the breast. Then we will search positively that if he has any other disease in the past. So in past medical history, we will search for any other disease like chronic liver disease, chronic renal problem, any heart disease for which he may take some medicine and causing this gynecomastia, and also any other illness in his previous record. Then we will ask him for any surgery, especially surgery for any malignancy, any testicular surgery or any urinary tract surgery which may result testicular atrophy. And after searching this past medical history, we will ask him for details to show his drug list. And there are numbers of drugs which can cause gynecomastia, specifically which drug enhance the activity of estrogen or decrease the activity of androgen or change the ratio of estrogen and androgen in male body will causes gynecomastia. And some drug, the exact mechanism is not clear but can causes gynecomastia like AC inhibitor, cimetidine, omeprazole. These are common drug which can causes the same problem. After the searching the drug list, we will also ask him about his family history. Any one of his family member, especially his father or brother, may have suffered from this problem of gynecomastia, and any other family member have any other disease like chronic liver disease, chronic kidney disease, or any malignancy in the family. And definitely we have to ask about any drug allergy because it is needed to manage the patient, and also ask for any blood transfusion which may be related with hepatitis B or C virus which may causes chronic liver disease. And also we will ask him any past other condition like any malignancy in the past diagnosed, has taken radiotherapy or chemotherapy, because chemotherapy for any other reason can damage the testicular tissue, can causes the same problem of gynecomastia. After searching this, we will ask him for systemic review, and a special importance is cardiovascular system, cardiothoracic system. These are shortness of breath, racing heart, because racing heart may be for atrial fibrillation. In case of the atrial fibrillation, patient may using digoxin, which may causes gynecomastia. Any orthopnea, which may be asked that do you feel any shortness of breath on lying or any shortness of breath on exertion, which will give you clue to the diagnosis of chronic heart problem. Also, patient must be asked about any cough, any production of phlegm, and also blood, streaky blood or coming blood with coughing, which may indicate a case of lung cancer. After searching this, we will definitely ask about tummy problem, like do you have any vomiting of blood, any passage of black, tarry, foul smelling stool, any history of yellowish coloration of your eye white, to exclude the chronic liver disease, and also tummy swelling, which may be due to ascites or any malignancy inside the abdomen, which may causes the same problem. And also must be asked about the water work. Is there any change in your water work, increase in amount or volume and frequency of your water work, decrease in amount, volume or frequency in water work, color change in your water work. And after then we'll ask in details about the endocrine problem. It is in the systemic review, and it should be asked about any weight change which may be related with thyroid problem, any weather preference, any change in ring size or any change in the shoe size recently, any thickening of skin, excess sweating, any change in sexual desire, like this. And after searching this, we may also ask about neurological problem, like any headache, any dimness of vision, or any vision problem, bumping over the shoulder when getting in and out through the doors. These are for searching any pituitary tumor. And also must be asked about any focal symptom weakness in any part of hands or legs, hands or feet, any shaking of hand, because this may also be related with other disease like Parkinson disease, for which he may taking the medicine, and this may causes gynecomastia. After a complete systemic review, we need to also ask about some common symptom, that is non-specific or general symptom, that is any fever, any mood change, which may also give a clue to the diagnosis of any psychiatric problem, and some psychiatric drug can causes gynecomastia. After a total complete systemic review, we will ask him about the effect of this problem in his life, starting from his smoking. Do you smoke? Do you drink alcohol? Because alcohol is related with chronic liver disease, and alcohol directly can causes gynecomastia. Then drug use, especially eliciting drug use, marijuana, opiate, these may causes gynecomastia. And after then I will ask about sensitively about the marital status of the patient, any extramarital relationship, if he has any partner, and he has any partner, and how he practicing sex, is it safe practice or any unsafe practice, which may be related with viral infection, hepatitis B, C, can causes gynecomastia indirectly. Then definitely we will ask about the occupation of the patient, how much this symptom is affecting his occupation, and some occupation may also affect or create this symptom by exposing to repeated trauma over the breast. Then we will ask him about other problem like his sexual history, which should be sensitively asked, including the partner's type of gender preference, and then also ask about the accommodation, where do you live, and definitely we will ask about his any travel history to abroad, any sex practice when he was in travel, and any hobby. After searching all of these causes, we will find that gynecomastia may be primary or idiopathic or may be secondary. In case of primary, in human male life, there is three stages of life where gynecomastia may develop. At the beginning of the life, that is initial 2 to 4 weeks of life, when gynecomastia may be due to maternal estrogen excess, which baby already exposed with this. And then at the end of the life, that is in older age, when estrogen level is gradually increased and testosterone level is gradually decreased, which may causes gynecomastia. In between this, in pubertal stage, gynecomastia is common and usually unilateral. So this is a physiological gynecomastia. To search out the pathological gynecomastia, must consider chronic liver disease. This is a common problem. Any heart problem for which he is taking any medication, then chronic kidney problem. These are the three common area, and then drug. After these four reasons, we will definitely search for the endocrine cause. Most common endocrine cause are hypogonadism, which may be primary hypogonadism or secondary hypogonadism, then thyrotoxicosis, and also pituitary tumor like acromegaly, and also Cushing syndrome. This endocrine problem can cause gynecomastia. So when we will examine the patient, definitely we will start from serially, starting from the hand. Like in hand, we will search for any stigmata of chronic liver disease like any clubbing, then palmarerythema, any flapping tremor, and any bruising. And for the carcinoma of bronchus, we may search for clubbing, any hypertrophic pulmonary osteoarthropathy, nicotine stain, or any muscle wasting, which may be due to Pankos tumor. And after searching this, we should search, examine the patient face to search any stigmata of chronic liver disease, any stigmata for bronchial carcinoma or chronic renal failure, any endocrine pathology like thyrotoxicosis, which may causes exophthalmos, and also moon phase for Cushing syndrome, acromegalic phase. And then we will gradually proceed towards the chest. In chest, we will search for hair growth, hair pattern, and then definitely we will examine the breast to see that is there really a gynecomastia or there is only lipomastia, is it unilateral or bilateral. Then we will search for any tenderness, any discharge. If there is discharge in one breast and also enlarged, which may indicate any risk of malignancy. Yes, that is breast carcinoma. Then we will examine the tummy of the patient to search any hepatomegaly, any splenomegaly, any jaundice, any intra-abdominal mass lesion. And in the chest, we will search for hear the vocal breath sound, and also examine for any effusion or any other pathology may be related with the heart failure, atrial fibrillation, or may be related with bronchial carcinoma. And then we will examine the private parts. There's the size of the testes. Is there an unilateral enlargement or bilateral enlargement or small streaky testes? This should be examined very carefully. And also secondary sexual characteristic, that is pubic hair, size of penis, any change in pigmentation all over the body, and also search for edema in both lower limb. After completion of this examination, we should disclose the patient what might be the cause, and then we can answer him that yes, you have this gynecomastia, probably this is due to a medication you are taking for your heart problem. So for the management of this problem, we will form a multidisciplinary team which will include the hormone doctor, heart doctor, and also specialist nurse to see you. And then we will go for investigation. In routine investigation, we will do renal function test, liver function test. These two are very important. Then a scan test for the chest to see any growth inside the chest. Scan, ultrasonographic scan of the tummy to see any liver disease, any intra-abdominal growth. And after then, we will consider 4 hormone, which will include the HCG, serum LH, serum testosterone, and serum estradiol. And these 4 tests will guide you the endocrine pathologist. Now I will show how to approach a patient with abnormal endocrine problem based on these 4 hormone problem. Hello. Now, how to approach with abnormal hormone level? First of all, we will see the hormones are HCG, then serum LH, serum testosterone, and serum estradiol. If serum HCG level is high, then we will consider two etiology, that is any growth which causing secretion of this hormone. This is possible from two sources. One is from the testis, that is testicular growth. Another, if the testicular growth is absent or ultrasonogram say no growth inside the testis, then we will search for any intra-abdominal musculation. Definitely this will come from testicular growth or intra-abdominal growth of any tissue which causing secretion of this hormone. So after HCG is high, definitely we will search for ultrasonogram of scrotum. If ultrasonogram of scrotum show no musculation, then intra-abdominal mass we will search for. And then second part is LH and testosterone. If LH and testosterone both are decreased, then the situation is this both hormone is decreased due to decreased secretion of LH from the pituitary gland. In this situation, we will first do prolactin level. If the prolactin level is high, then it is prolactinemia, hyperprolactin, that is prolactinoma. If prolactin level is normal, in that situation we will search thyroid function, that is TSH. If the TSH level is low, then it is due to thyrotoxicosis. If LH level is increased, testosterone level is decreased, then it is clear cut primary hypogonadism. Then we will search for the reason of primary hypogonadism. There is any history of moms, any history suggesting Klinefelter syndrome, or any trauma or any surgery or any chemotherapy, chronic liver disease which causing decreased level of testosterone. Then if this is confusing, that LH and testosterone level, LH is normal, testosterone level is seems to be normal, then estradiol will help. If the estradiol level is increased, definitely there is source of estradiol inside the body, especially we will search the testis and testicular growth. If there is no growth in testis, then we will search for any adrenal growth. If there is no testicular growth, there is no adrenal growth, then aromatase activity has been increased. In a situation where testosterone level is increased and also LH level is increased, that is both of the hormone increase, which is possible in androgen insensitivity syndrome. So from these four tests, HCG level, LH, testosterone and estradiol, it will guide the exact pathology where it is located. Then we can search and find out the exact reason. So after finding the exact reason, we may find that is physiological change, that is in puberty or newborn, or there is some pathology. In case of pathological situation, we will first treat the primary disease, and after treating the primary disease, this gynecomastia may not be reversible because there may be fibrotic change which will not reverse. In this situation, cosmetic surgery is needed. But if gynecomastia develops within 12 months, then there is possibility that estrogen receptor blocker or selective estrogen receptor stimulant will causes the reduction of the size of this gynecomastia. And definitely we will try to treat the primary reason, because just treating the gynecomastia might not be enough. especially in case of bronchial carcinoma, any testicular growth or any other reason where the primary disease is very serious. And this is overall in a nutshell. First, clinical history, searching for a specific disease. Is it primary, that is pubertal gynecomastia, or in the geriatric age group, or at the newborn, and then search for the pathology: chronic liver disease, chronic kidney disease, any thyroid problem, any other endocrine problem, any carcinoma inside the bronchus, any testicular growth. These are the principal causes. So after searching the appropriate pathology, we will treat the gynecomastia in that way. Hopefully it will help you to understand the gynecomastia, but this is not all, and my presentation may not help you, but I have tried my best to make you understand how to manage a patient and approach a patient with gynecomastia. Thank you all.